Hello, everyone. My name is Marguerite Daniels, and I'm currently a student at Liberty University in the Doctorate of Nursing Practice program. Today, I'm going to be discussing how mobile apps are going to be useful or impactful in the management of chronic kidney disease. Firstly, why chronic kidney disease? So, a little bit of background on the disease process. Chronic kidney disease is a progressive condition affecting the function of the kidneys. So primarily it affects how well the kidneys are able to maintain hemostasis in the body. It's a public health concern because it's affecting about 8 million individuals globally, contributing to about 3% of our current healthcare expenditures in the United States of America. It's linked to obesity, aging, diabetes, and hypertension, with diabetes and hypertension being the two most common causes of chronic kidney disease in the US. Poor awareness and restrictive comprehension have been noted as two of the most common contributing factors to the disease process, which means individuals are either unaware that they have the disease process or they're unaware of how other comorbidities are contributing to the progression of the disease process, which is profound considering that chronic kidney disease can either be delayed or prevented with proper management. Disease management in chronic kidney disease requires a multifactorial approach, inclusive of interventions that provide early prevention, timely diagnoses, effective evidence-based therapy, and a continuous monitoring plan. Self-management has been identified as the key factor in slowing the progression of chronic kidney disease. Individuals with chronic kidney disease have shown to benefit from a real-time, personalized, interactive health approach. Traditional healthcare practices have shown to be limited in their ability to provide these benefits. Therefore, the evolution of mobile health technology, specifically mobile health applications, have shown to be very efficacious when used in conjunction with traditional healthcare practices in the management and or prevention of chronic diseases. Why mobile health apps? Well, research is showing that 91 to 98% of individuals in America either have access to or own a smartphone. Mobile health apps have shown to promote patient engagement. They've shown to empower patients. They promote communication between patients and their healthcare providers. They make it easier for healthcare providers to monitor their patients at home. They also have tools which increase medication adherence, and they also are able to assist in the early diagnosis of diseases, and they can also detect early deterioration in conditions, thereby maximizing patient health care outcomes. Mobile health apps are equipped with several roles, one of which is the educational or knowledge role. They actually empower patients to learn about their disease process through education that's through educational information that's placed inside of the app and allows the patient to access that information at times that are very appropriate for them. They also enhance communication and collaboration because a lot of them provide a bi-directional communication component in which patients are able to send information to their healthcare provider and receive a response back in a timely manner. They monitor and track health data, and they have AI programs that actually create personalized care plans. These components actually encourage patient engagement, and more patient engagement actually means more patient adherence, and therefore contributing also to improve patient healthcare outcomes. In a retrospective study conducted on apps which were most efficacious in the management of individuals with chronic kidney disease, the components that were found to be necessary to the slowing of the progression of the disease process were applications that were included information on nutrition, information on medication management, symptom management, and lifestyle management. When reviewing the American Association of Colleges of Nursing's essentials, the four domains that I found most relevant to the role of the doctor of nursing practice in the care of patients with chronic kidney disease were domain 2, which spoke to the organization and system leadership for quality improvement. This particular domain speaks to the role of the doctor of nursing practice in being a leader in the promotion and education of the use of any interventions that have shown to improve the quality of care in patients. Domain 3, which speaks to the scholarship for evidence-based practice. This particular domain speaks to the need and the importance of the doctor of nursing practice to utilize research-based practices in the care of patients. Domain 4 speaks to information systems and technology and patient care technology for the improvement and transformation of healthcare. Research is showing that the use of health applications, the use of mobile health apps are very effective in the improvement of patient outcomes. And the goal of the doctor of nursing practice is to participate in practices that are designed to improve the outcome, improve patient outcomes. Lastly, the domain 6, which speaks to the interprofessional collaboration for improving patient and population health outcomes. Now, this particular domain speaks to the need of the doctor of nursing practice to participate in any practices that improve collaboration, meaning whether we're interacting with the patient or whether there's interaction with other healthcare professionals that are providing tools that will actually increase the healthcare outcomes in patients under the doctor's care. In this portion of the presentation, there were two articles that were reviewed. The article written by May et al. Was consisted of two groups. It was a total of 808 participants. One group, these participants were divided equally. One group received AI interventions. The other group received traditional medication interventions, meaning that they went to their nephrologist and they scheduled visits. The AI intervention group was nurse led. The indicator for how if the effectiveness of this particular app was determined by how the patient's filtration rate were, so their glomerular filtration rate. This particular app, the name of the app was called Kidney Online Intelligence, and the results showed that through the use of AI interventions, patients' disease process was definitely slowed, and the progression of the disease was lessened. Chronic kidney disease is a progressive condition with an expectation to progress into the fifth leading cause of death in 2040. Poor disease awareness and limited understanding related to the progression of the disease are the primary contributors to the disease progression. Improving self-management skills have been identified as a key indicator for mitigating disease risk and slowing disease progression. Research has shown that the use of mobile apps are efficacious when used in conjunction with traditional medical practices in the management of chronic disease progression and improving patient care outcomes. It is inclusive in the role of the doctor of nursing practice to incorporate evidence-based practices, utilize interventions with proven capabilities to improve patient care outcomes, and to enhance patient and professional collaborations. Although mobile health applications are not without their barriers, they are shown to be effective in the collaboration of care in patients with chronic kidney disease. Thank you for your time.